is Common Ground, creating equity through public policy and community engagement.
Hello, everyone. I'm Lyn Vaughn. Welcome to another edition of Common Ground, Fulton County's much celebrated answer to health disparities. Now, this integrated care service delivery approach is putting all public services, health, employment, library, and the arts in one location to address all of our constituents' needs, as the title on Common Ground suggests. Now, in this show, we're talking about one of the two departments that comprise Fulton County Health Services. Those departments are Health and Wellness and Behavioral Health and Developmental Disabilities. With me today is the Medical Director of Behavioral Health and Developmental Disabilities, Dr. Sultan Simms. Dr. Simms, welcome to Common Ground.
Thank you, Lynn. Thank you for having me.
Yes, this is a topic that's getting much more talked about in the news. But first, let's get an understanding of what we mean when we say behavioral health. What does that encompass?
Well, when we talk about behavioral health, some people look at it as a focus on the neck up, disorders of the brain, and we talk about emotional health. Common disorders are anxiety disorders, depression. In some cases, we see people suffer with psychotic disorders. So, you know, and when you talk about behavioral health, not only do you talk about the conditions, you talk about the treatments that are available for those conditions.
Okay. What among those is the most common?
I would say the most common are the anxiety disorders. Some people are familiar with things like panic attacks, obsessive compulsive disorder. There's a generalized anxiety disorder where characterized by someone just having anxiety about any and everything. And this can really, what we really focus on is how these disorders impact a person's life.
Mm-hmm. Isn't that just about, don't all of us have some kind of anxiety from time to time? What is the difference between just that normal level of anxiety and a disorder?
Right, and so when we talk about disorders, we don't want to make everything into an illness or a disorder. So we really focus on how are these symptoms impacting this person's life and their ability to function. If a person's unable to meet obligations, go to work, go to school, pay the bills, maintain relationships, then it's a problem. And that's when we want to kind of encourage that person to get help and see what we can do so that they can function optimally.
Well, generally speaking, how prevalent is mental illness in the U.S.?
It's quite prevalent. We have studies that show that maybe 1 in 4 adults suffer from some form of a mental illness. So they're quite prevalent, and we really need to get the word out.
Mm-hmm. And serious mental illness, how big a piece of the pie is that?
So there's one study going back, I believe it was about 2004 data, that suggested about 1 in 17 people may have a severe mental illness. And when we're talking about severity, it's just how much is this impacting this person's life and their abilities to function moving forward. We commonly look at conditions like schizophrenia, bipolar disorder. And what we see a lot in that population are people who have multiple psychiatric conditions. One may have a diagnosis of an anxiety disorder and a major depressive disorder or some psychotic illness. And the more comorbidities you have, the more it's likely to be a severe illness and to severely impact your ability to function.
Well, now, addiction is a much more common problem, and that also can be a mental disorder. Tell us about that.
Absolutely. We consider addiction mental health disorders because we have increasing evidence to show that when a person puts drugs into their body, it affects their brain, and on a chemical level, it affects their brain, and we see changes, we see alterations that lead to changes in their behavior. You talk about addiction, you're talking about a certain set of behaviors, drug-seeking behaviors. That family member who maybe has become unreliable, who's maybe stealing from family members and friends to support their habits. So we see those drugs affect your mind in a way that affects your behavior.
What's leading to the increase in addictive behaviors and addictions to drugs and even prescription medications?
Well, access is always a key. It's always hard to say. These things are multifactorial: environment, what's going on in a person's life, financial means, access, particularly with prescription pain medicines. We've seen an explosion really in addiction of those drugs because they're increasingly accessible. People have pain. There are people who need these medicines, and it can become very difficult to tease out who should have them versus who shouldn't have them. And many well-meaning people with real pain go on to develop an addiction. It was an honest thing that just happened. They were trying their best to cope with their pain.
We hear about that with certain celebrities who experience that.
Yes.
Now let's talk about the second component of your department, which is developmental disabilities. Tell us what kind of illnesses we're talking about when we talk about the developmentally disabled.
Well, we're talking, when you hear the term developmentally disabled, there are so many things that can go wrong during the stages of development. And so, like I said, there are many things that can go wrong. It's hard to say what exactly went wrong, but the end result is someone may have physical disabilities, they may have cognitive disabilities, disabilities in their ability to reason, think clearly, process information. We have clients with a lower IQ, which makes it difficult for them to learn certain things and to retain information. So we really work towards, dealing with that, dealing with those deficits.
Well, as you were pointing out, I heard one of our famous media doctors say recently that no one thinks twice about seeking treatment when you have an ache or pain below the neck. But when it's above the neck, people don't want to do it. Why is that?
Absolutely. And, these are issues that go back, a long time. Stigma is what we're really talking about here. Unfortunately, many people see mental illness as a sign of weakness. There's shame related to going and seeing a psychiatrist. And there's just that there's people are looked upon differently as opposed to if they break their arm or break their leg. There's something you can see, but people can't really see when something's going on in a person's mind. And so what they tend to do is because of the shame, they retreat, they hide. Rather than get help, they try to avoid people, and things tend to just get worse. So we really need to get the word out. These things can happen to anybody. It's not a sign of weakness. It's not necessarily anything that you've done. Help is available, and let's go on and get that help and get better.
Okay. Thanks so much. We will be back with Dr. Simms in just a moment. Welcome back to Common Ground. Our guest is Dr. Sultan Simms, Medical Director of Behavioral Health and Developmental Disabilities in Fulton County Health Services. Dr. Simms, just before the break, you were talking about we've got to get folks help and we've got to get them treatment. And so we're in Fulton County and we want to do that. Tell us about the services available for behavioral health treatment in Fulton County.
Okay, so we have a variety of services available. We have adult behavioral health services. We offer diagnostic assessments, referrals to appropriate. We can't do it all in Fulton County. So for those things that those needs we're not able to meet, we'll refer people to the appropriate place. In addition to diagnostic assessments, we provide medication management, individual counseling, group counseling. We do have substance abuse groups that we offer. We have a child and adolescent psychiatry program where we, offer the same things: diagnostic assessment, medication management, same services. In addition, we spoke earlier about our developmental disability services. We have 3 training centers. And in our training centers, we really focus on addressing those deficits that I spoke to you about earlier, basic skill training, trying to teach people to complete tasks out in the community so that they can function optimally in the community.
Well, that is one of the things we saw with the developmentally disabled program was the Special Olympics.
Yes, I'm very proud of that.
Trip to the Special Olympics that some of the clients took, and that was it was remarkable to see them, and you see the improvement, how they come out the more they experience the world.
Absolutely, they love it. You know, the families love it. They, you know, they do their best, and we've done pretty well. I think the past couple of years, taking home a couple of medals.
Yes.
So we're happy about that. Our staff give of their time, and they participate as well. So that's something that we're really proud of.
Great. Well, let's say a person presents at a clinic, and you say you do the diagnosis first, and the person, all he or she knows is that I'm, you know, in malaise. I don't feel like getting out of bed, and so where does it go from there?
Right. Well, you'll come in, and you know, you'll let us know that you're in need of some sort of need, and so we sit down. We spend time with that person. We ask, based on our training, there are certain questions that we ask about, you know, different aspects of that person's life, not just the symptoms that they're having, but also heavy emphasis on what impact are these symptoms having. We ask about your family life, your occupational history, past and present, your history of any psychiatric treatment or conditions, your medical history. Because again, your mental health is connected with your physical health. It's important to know that some physical illnesses, their first sign is a mental health illness. There are some people with cancer who you diagnose that based on them saying, I'm depressed. They come in for an evaluation, you do a medical workup, next thing you know, you find out they've had a certain kind of cancer. So it's a comprehensive assessment that needs to happen, and it's important to diagnose accurately, because treatments vary depending on the diagnosis. What I may prescribe for someone who has schizophrenia may be different than what I prescribe for someone who has anxiety or depression. So it's very important to have an accurate diagnosis. It guides all of the treatment recommendations, not medication only.
How successful are the treatments for adults?
I would say that the level of success varies. We have to define what success is. Generally speaking, I would say the treatments have come a long way, and they're very successful. We can get people back to a point where they're functioning in the community, as opposed to, you know, imagine what it's like to go from working one day to being in an inpatient hospital where you can't leave. We want to get people, if you're in the hospital, you're not interacting with your family, you're not working, you're not in school, you're not functioning. So I think our treatments are very effective at getting people back to work, back to school, and even if they're not back to 100%, which we can do, but there are times when maybe that person's not back to 100%, but at least they're out and they're functioning, they're contributing.
That is wonderful. And that brings us to the services for children. What kinds of services are available for kids who need behavioral health treatment?
Some of those same services. In addition, we have partnerships with the schools. You know, we'll do groups in schools. We have relationships with school counselors and school psychologists. They may refer people to us, and we provide assessment, diagnosis, and we'll come up with a treatment plan. We work with families to connect them to resources. Imagine you have a family, a parent who's homeless, and now they have 2 or 3 children with them, and they're in need of services. We have staff members who go out into the community and work towards connecting them to these different services. We work with some of the daycare centers, Sheltering Arms in particular. We provide consultation to them, and so there are a number of things in our CNA program that we do.
And is that what happens at the new beautiful, renovated,
wonderful
lovely,
Oak
wonderful
Hill
Oak Hill? I mean, I just
Absolutely.
I can't sing its praises enough. Just a beautiful place.
Absolutely.
Tell us about that.
It's a wonderful place. We have a number of programs there. You mentioned some at the beginning. We have housing there. We provide dental services there. We have room for some primary care pediatrics to be involved there. We focus a lot on partnerships, bringing people in and seeing what we can do together to serve the children in the area. So it's a wonderful place, and we're continuing to grow.
Had the opportunity recently to watch the little ones plant their first community garden. When kids come in, or they have to be brought to you by an adult, I would take it, because they may not necessarily know what's going on with them. What signals is it that parents or guardians should look for when kids seem to be troubled?
Commonly it's behavior. You know, a child is not going to come to you and say, Mom and Dad, I'm depressed, or Mom and Dad, I'm having a panic attack. You'll see changes in their behavior, whether it's at home or at school. Sometimes it's specific to the environment. Sometimes you see it across environments. And so once you see this behavior and it's not responding to your basic parental interventions, that's the time to ask, to reach out and see what help is available. So really look at that child, their behavior, know your child, know when they're acting a bit different, they're withdrawn or they're a bit more aggressive or they're crying more. These are signs that something may not be right.
And for older kids, well, actually, the Oak Hill Child, Adolescent, and Family Center is for children from infancy to 21.
Yeah, right.
But there's also a special place for teens who can often find difficulty having behavior issues.
We have a particular program, our Clubhouse program, and that's really for adolescents who are at risk for substance use. We found that they may be engaging in some high-risk behaviors. Maybe there's already some substance use that's in place. So we want to work with them and intervene early to prevent some major addiction from developing and causing increasing problems in their lives. So that's a wonderful program. We have a particular facility that was renovated by our wonderful facilities staff
department,
here. Right.
Clubhouse for Youth.
Our Clubhouse for Youth, and it's a great program. It's going quite well.
Great. Okay. We'll be back in a moment with Dr. Simms and more on behavioral health and developmental disabilities. And welcome back to Common Ground. I'm Lyn Vaughn, your host, with Dr. Sultan Simms, Medical Director of Behavioral Health and Developmental Disability Services in our Fulton County Health Services Division. Dr. Simms, we were talking about teenagers who have services at the Clubhouse for Youth. Yes. How do we know when teens are being teenagers or when they are troubled and need our help?
Well, it's difficult. It's probably an age-old question. It really takes a keen eye from a parent. It takes a lot of involvement. Be aware, be present, be involved in your child's life, because that's really the only way you're going to be able to detect when something is going wrong. You have to talk to them, ask them how things are going at school, ask them about their relationships. Understand they may not always be forthcoming with information, but continue to be involved, continue to ask those questions, and to, like we said earlier, look for changes in behavior. Don't expect an adolescent to come to you and say, this is the problem and this is where I need help. You're going to see changes in behavior. Maybe that A student's grades are now slipping and all of a sudden they're bringing home C's. Maybe that child or adolescent who is very outgoing and very social, all of a sudden they're home in their room all of the time and it seems like they're crying, and maybe the way they're dressing is starting to change from a very colorful, bright style of dress to a very gray and dark and gloomy style of dressing. Those things aren't always an obvious sign, but those are windows into what may be going on.
What can we do to stop some of the internet troubles that we see kids having these days? The bullying, the cyber stalking. How do parents intervene in that and respect the privacy of the child at the same time?
Well, it starts with education. If you remember that it's a privilege that you're giving your adolescent access to these things. They may think they have a right to a computer or an iPad, but they don't. As a parent, if they have those things, it's because of you. You're responsible, so you need to take responsibility for that. You need to explain to them that these are the rules. This kind of behavior and these kind of communications are acceptable, and these kind of communications are not. and let them know that you will be monitoring their activity. That's not an invasion of privacy. You need to let them know up front that I need to monitor what's going on with you, because people are going to hold me responsible as your parent. And let them know what the consequences can be. There have been some high-profile cases. There was one very recently where a young lady ended up committing suicide. She attributed it to being bullied at school. And allegedly, one of the young people made a mean comment even after the person died. So that's the time to sit down with your adolescent and say, okay, this is what can happen. You are not going to do this. And so it's really about education and involvement.
I like the part about consequences and also privilege.
Absolutely.
It can be given and it can be taken away. Back to our programs for the developmentally disabled. What are the challenges facing those clients?
Well, many of these clients are unable to care for themselves on their own. Now, there's a wide range in level of functioning. There are some who have kind of a mild impairment and with their proper amount of support can, have a job. Maybe in some cases live independently, although that's not really the case with those that we serve. But then there are some who are total care. They need help with basic tasks, basic grooming, personal hygiene. So without the services that we offer, life would be very difficult for them and very difficult for parents and family members. Without being able to come to our training centers, these families wouldn't be able to work. Or go to school or contribute in other positive ways that they are contributing to our community. So,
and our training centers are located north, central, and south. And what takes place there? Are the clients dropped off by the parents? Do we pick them up? Tell us a little bit about it.
I would say in most cases we have a bus service that will go out to the homes and pick clients up. There are some families who choose to drop their family member off and pick them up. So, both modes of transportation happen. We have instructors and skills trainers who are there working with the clients all day in a very close, kind of small group setting, and we tailor our interventions based on the needs of that client. So it's not that everyone is just in one big group doing the exact same thing. We sit down, there are a team of professionals involved in doing the assessment, figuring out what goals need to be set and what needs to happen moving forward to help this person function optimally. And on a day-to-day basis, we work on improving those skills that we've identified as needing improvement.
Well, we not only followed our clients as they were practicing bocce ball, but we also had the opportunity to see them on a trip to the Capitol, where Governor Deal celebrated, I believe it was the 15th annual Disability Day at the Capitol. And so to have the clients out there with other people, caregivers, thousands and thousands of people, I think you're right, it's important to have them out and functioning and exercising the skills that they can.
Absolutely, and it helps with awareness. We are our own best advocates. We need our clients to not be in the shadows. They need to be out so people can see them and see what they're doing.
They're a part of us.
And they bring value to our community. And, budgets are tight. Funding has to come from somewhere. So we need people to kind of get up and stand up and say, look, we have needs. We're here, we're present, and to ask and advocate for services to be provided.
And finally, I understand that we also do work with the jail and the court system to treat incarcerated persons who are suffering from mental or behavioral disorders. Is that right?
Absolutely. What we really want to do is intervene. These are people who maybe, because of their mental illness, are committing crimes and are ending up having contact with the justice system. So what we do, once they get in, we have a team of really case managers. They'll assign cases to our case managers. We'll kind of monitor them while they're in jail. And once they get out, we make sure they're connected to treatment. make sure they have stable housing, and to the extent that we can, we help them get access to other resources in the community, whether it's job opportunities or ability to get a GED or applications for Social Security and any other benefits that are available. Those are the things that we focus on, and with the long-term vision and hope being that when you give people the support they need and the services they need, maybe they'll be less likely to commit crimes and end up back in that revolving door that can be our criminal justice system.
Well, that's a big woohoo for that. Let's hope so. Thank you so much for being with us. This has been delightful, and we're going to have to do this again.
Absolutely. My pleasure. Anytime.
Okay. We'll be back in a moment. As Dr. Simms has pointed out, there is absolutely no shame in seeking mental health treatment for yourself, your children, or friends or family members. To take advantage of the services offered by Fulton County, we'd like for you to visit or call one of these centers: the South Fulton or the West Fulton Behavioral Health Centers, the Adamsville Regional Health Center, the Center for Health and Rehabilitation, our Neighborhood Union Health Center, and the North Fulton Service Center Health Center in Sandy Springs. Now, assistance for children is available at the Oak Hill Child, Adolescent, and Family Center and the Clubhouse for Youth. The best number to call to reach all of the behavioral health and the developmental disability centers is 404-613-3675. The web address is livebetterfulton.org. I'm Lyn Vaughn. We'll see you next time right here on Common Ground.